Welcome back to Morning Break and this week's Monday Motivations brought to you by Gates Brain Health. We are so excited that Dr. Randall Gates is back with us. He is a board-certified chiropractic neurologist. We are so excited you're here
and
that we're back
physician.
together. And chiropractic physician.
You got
Don't
it.
forget it.
I
know I should have written it in the prompter. I thought for sure that like after all this time together, my memory would have been
but
good.
I was impressed that it was not there and you
had
said
it all.
Yeah.
I love that we're doing these interviews, and I love that this interview in particular is almost like an accumulation of everything we've been talking about, and that is the relationship between our gut and our brain, specifically diet. And diet is so important to our overall health.
Yeah, and I think when a lot of doctors tell a patient to change their diet, the feedback I get is that most people don't know what to do. They don't know what diet to go on. There's so many confusing aspects to it. Back in 20 years ago, it was Atkins. Now it's keto. And then do you do paleo? Should you be vegan? Should you be vegetarian? So it's gluten-free. So we have all these kind of fads that run through. No denigration to any of those as being a fad, but you know what I mean.
Yeah.
There's the hot diet for the period of time, and I think it's just confusing for a lot of people.
Yeah, because not every diet is right for you. So that's what we're really talking about, is how to find those things that work for you, but also knowing that like why what you put in your body matters. And so you have a couple of really good examples that we can kind of run through. And the first one that I love is why when you eat that big Thanksgiving meal do we get so tired afterwards? This is great because I'm definitely susceptible to that.
Yeah, because a lot of people would say it was the high tryptophan and the turkey. We're actually thinking now that it's probably an insulin surge because we eat so many carbohydrates. You have the rolls, you have the stuffing, you have the mashed potatoes. And so you're eating so much, you're getting a lot of insulin release, and then that is what makes you feel tired. And really that's something that people probably deal with on a daily basis. How many people eat lunch and then they need a nap? You know? Yeah, exactly.
No, I remember I was in grad school and I actually taught a class that was right after lunch, and getting my kids to do anything was a nightmare.
Yeah. I wish I would have known that going through college because I was always so sleepy in the afternoon.
Exactly, so maybe those 7 a.m. classes ain't so bad. All right. Okay, the other thing that I definitely have experienced is food relationship to migraines.
Right. So chocolate, cheese, and wine. So many people say avoid those foods. But I'm finding it goes way beyond that. There's new research connecting the mast cells. I've done a lot of YouTube videos on them. Mast cells are a type of immune cell that release histamine, and we're thinking that there are many different foods that can be provoking the histamine response in migraineurs. And it may not just be one food. It might be 5 foods coming together with things like stress that are then relating to their headaches.
Okay, another one that you mentioned kind of already is people going on gluten-free. Very common nowadays, but you're saying that gluten might actually affect our mood, balance, and neuropathy.
Oh yeah.
Yeah, explain that.
Yeah, so when you say I'm going gluten-free, people typically think I'm doing it for digestive issues. The research on that is actually debatable. So there's some research saying that gluten can affect digestion in some people outside of celiac disease, which is about 1% of the population. But there's definitive research showing that those who feel they're gluten sensitive, it's actually affecting their brain more than anything. So the #1 symptom is dysphoria, or a feeling of depression upon eating gluten. And that could be between 5 to 17% of the population feels that way when they eat gluten.
Really? That is so interesting.
And then neurologically, gluten is really important for neuropathy. Neuropathy is a big issue. It can affect, I believe, 10% of people over the age of 65. Usually it's diabetic, like half the time. The other half the time, they don't really know the cause, but a big portion of that other half of the pie is actually gluten. Individuals with balance issues, I talked about gluten there, because if you have an immunological response to gluten, it can actually attack your cerebellum, your balance center.
Wow, we are learning so much. I want to talk about that so much more, but we want to get through one more, and that is dementia and high-carb diets.
Yeah, so regarding dementia, there's so many different causes, and within dementia, Alzheimer's is the most common type of dementia. The research there is showing that insulin resistance seems to be the one unifying factor for most of the cases, and the insulin resistance stems from our diet of eating lots of times too many processed carbohydrates, saturated fats for a lifetime, changes our gut bugs, and we develop insulin resistance even if we're not eating a lot of carbs. And that insulin resistance can drive the dementia response in the brain.
That's interesting. Okay, so between dementia, your mood swings, fatigue, migraines, there are so many different things that we could talk about and dive deeper into that your food relates to these different things.
And then, you know, vegan, vegetarian relating to vascular disease in the brain, that's a whole nother topic.
Yeah.
So there's so many elements to it, and I think that's what I try to relay to patients. You know, we're so ingrained in the standard healthcare model. You see your doctor, you get a pill or some treatment, and then you see them in 3 months. I work with patients almost on a daily basis through communication to help them, guide them, show them the way, because this is a very different paradigm on how I work with people.
So basically, before you change anything in your diet, you need to see Dr. Gates so that he can actually help you decide what is best for you when it comes to the foods that you eat. And who knows, maybe a simple change in your diet could lead to very long-lasting and impressive changes in how you feel. So thank you, Dr. Gates. I appreciate you being here.
Yeah, happy to be here.
Thank you so much. We'll be right back after this quick break.